Continuation with the RCH program. So other components coming under this program is drug and equipment kits. So at some center level, at PHC level and CHC level, the drugs and equipments needed for the delivery and the child survival, for all these drugs and equipments needed for that, it is being provided in all these levels. Essential newborn care. To reduce the perinatal and neonatal mortality rate, we have started this essential newborn care. Main components are resuscitation of newborn with asphyxia, prevention of hypothermia, prevention of infection, exclusive breastfeeding, and referral of sick newborn. So these are the components coming under this. So we have equipments and the provision of drugs in all the levels to prevent all these health issues that is seen among the newborn, thereby neonatal mortality can be prevented. Oral rehydration therapy. Diarrhea is one of the leading cause of child mortality. Twice a year, 150 packets of ORS are provided to all the sub-centers in the country. Adequate nutritional care of the child with diarrhea and proper advice to mothers on feeding are two important areas of this program. So from these centers, that is from CHC, PHC and from the sub-center, ORS packets are being provided for the under 5 kids, because diarrhea can be prevented with proper hydration of the kids and with adequate breastfeeding. So these are the two components more and more advised to prevent or to control diarrhea, which is a major child mortality component or cause. Acute respiratory disease control. Case management of acute respiratory infection and prevention of death due to pneumonia is now an integral part of RCH program. So it is very important. Second to diarrhea, major health issue that is seen among the kids which lead to child mortality and morbidity is the pneumonia and respiratory health issues. So that is why this program or this component is also integrated under this RCH program. Cotrimazole is being supplied to the health workers through CSSM drug kit. So it is a drug of choice that is being provided from all the health center level along under this CSSM component to prevent respiratory issues among the kids. Prevention and control of vitamin A deficiency in children. Under this program, at 9 months, first dose of vitamin A, that is 1 lakh, is given, and in subsequent doses 2 lakh international unit is given in every 6 months interval up to 5 years. So total 9 doses of vitamin A is being provided for the kids, thereby visual disorders can be prevented among the children. Prevention and control of anemia in children. Under this program, tablet containing 20 mg of elemental iron and 0.1 mg of folic acid are provided at the subcenter level. Currently, program guidelines instruct the health workers to provide 100 tablets to children clinically found to be anemic. So this is identified by the school teachers during the time of school health program or by the paramedical staff. Suppose sometimes even school teachers in the classroom, some students seems to be very weak, always sleeping, lethargic, and tired, and common signs and symptoms which seems to be of anemic is seen in the kids, and they themselves refer to the health centers saying that this girl or this boy seems to be anemic. And similarly, other cases is by during the time of school health program, the paramedical and the medical staff, once they are doing the services or health checkups, they are identifying. So in that way, this for the anemic cases, the regular medical supply of iron and folic acid is being supplied at the school level and also at the health center level. Thereby, anemia seems to be a major health issues among the adolescents and among the kids can be prevented. And this program is also, and this component is also being running very successfully in all government hospitals, in government schools and even too in the private schools too. Coming to the RCH 2 began from 1st April 2005. The focus is to reduce maternal and child mortality and morbidity with emphasis on rural health care. So main target of this program is also to reduce the child mortality, maternal mortality and morbidity, especially in the rural areas. So main strategies are again the same, that is essential obstetric care, emergency obstetric care, and along with that we don't have that components what we have discussed till now. We are integrated all these under one component, that is strengthening the referral system. So all these health issues are being taken care by the referral system. So this referral system is the center, is the health centers, and that is being strengthened very well, and provision of all the equipments, drugs, manpower is being provided to these centers. So thereby the center is strengthened very well to manage all the health issues seen among the mothers and the kids. Essential obstetric care, institutional deliveries, mainly to promote the institutional deliveries, we have round the clock delivery and newborn care services could be ensured by providing 3 to 4 staff nurses at the PSCs at round the clock. Thereby all the health issues are managed at any time of the day. Skilled attendants at the delivery aim to reduce the maternal mortality. We have training is being given for the skilled birth attendant. SBA means skilled birth attendant, to conduct normal deliveries, and in complicated cases how to manage, that also being taught. So obstetric emergency training is being given both to the skilled birth attendant and to the doctors. So in that way, normal delivery and emergency cesarean or emergency risk cases are also can be managed along with the doctor. This SBS permitted to use emergency drugs and interventions by the ANMs and SBA when the life of the mother is in danger. So these are called as standing orders. So in emergency cases, these standing orders can be used by the ANMs or SBA to save the health of the mother and the child. Emergency obstetric care, first referral unit be made operational for providing emergency and essential on obstetric care during the second phase of RCH. So these are the services that is provided under RCH 2. RCH 2, the services coming under first referral unit is 24-hour delivery services, emergency obstetric care, that is cesarean section, safe abortion services, newborn care, emergency care of sick children, blood storage facility, essential lab services, referral services, treatment of STIs, family planning services. So all these services are being provided in the first referral unit coming under emergency obstetric care. Strengthening of the about these components I am not going in detail. Already we have learned it in the previous slides. When you come to know about these services in detail in MCH, you might have learned about that. So coming to the strengthening referral system, different states have proposed different modes of referral linkage in RCH phase 2. Some of them have indicated to involve local self groups, NGOs and women groups, whereas few others have indicated to outsource it. So we are strengthening the referral system. We do have the sub-center, PHCs and CHCs strengthened in a universal manner, in a standardized manner. These are being integrated and strengthened very well. Along with that, we are also taking the help of the self-help group, NGOs and women to get the services very well run in these NGOs, helps to motivate the general public or the local people to bring to this health centers to get the health services. New initiatives coming under this program are training of MBBS doctors in life-saving anesthetic skills for emergency obstetric care. So this type of training is being provided so that they can use the anesthetic skills in case of emergency. They can do even the cesarean section because the saving of the mother and the child is very essential or very important. So to get that, the MBBS doctors are being trained to utilize these anesthetic skills to manage the obstetric care. Setting up blood storage centers at the FRUs. So in all the first referral unit, now presently we have blood storage unit. So during the time of surgery, there is no need to for the local people to get around to search for the blood. So blood storage unit is also being available at FRUs. Safe abortion services are also being provided in this. MTP Act is being instilled in this program. And JSY and other national health schemes you might have learned in MCH services. You can brush through that. In that JSY is the major scheme that is running under this RCH program. It is launched in 12th April 2005, and I am not going to detail about JSV because we already learned in MCH service class. I hope you are remembering. You can get along through the previous notes of MCH services regarding MCH schemes. So what is the role of nurse in RCH program? That is maternal health services and child health services. By implementation of the program in an appropriate level, we are doing this program very well. So So thank you all. So this is all about family welfare program and the RCH program that is being integrated under family welfare.